And then just a couple examples of AT for hearing impairment. Again, we know hearing impairment, we saw that on one of those census charts, is another one that increases as we age. There are telecoils, and telecoils expand the usefulness of hearing aids and cochlear implants, especially in environments that it's typically challenging to hear clearly, so louder environments. Telecoils are also called T-coils, and they're built into many hearing aids, and most cochlear implants as well. And they are a really essential component for anyone that wants to easily and directly access an assistive listening system. Hearing loops, so those are also called induction loops. Those are like a copper wire within a room, or sometimes in theaters, or other, conference rooms sometimes. And those loops are probably the most user-friendly of all the listening options. They're simple, they're discreet, and they seem to work well. So the user simply switches their device to the telecoil program, and then automatically receives the sound being directly into their ears, being broadcast. And then people who don't have hearing aids or don't have access to telecoils in their hearing aids use the loop receiver and a headphone or a Bluetooth to connect to the system. And then there's IR, infrared systems, and those work more like a TV remote control. There's a transmitter, and that sends the sound from a public address or a sound system to IR, the infrared receiver. And so that uses invisible magic waves. But that technology is line of sight and can't be used really outdoors because of light, because it can be affected by the actual light of an outdoor setting. And so they're people that they're not quite as effective, because sometimes there might be a balcony or someone further away or with poor line of sight, and so it doesn't receive that information as well in those scenarios. But it's another good option in others. And then FM systems, and these are also radio frequency assistive listening systems. These transmit a wireless low power FM frequency from a sound system to a receiver. And so this is not affected by direct sunlight, and that's one reason this can be sometimes preferable to the IR systems. So everyone that is using this system needs a receiver and either a headphone or a neck loop. And so alternatively, if someone does have one of the telecoil equipped hearing aids or cochlear implants, the neck loop eliminates the need for those headphones. So anyway, those are some options for hearing impairment. And then also communication access real-time translation, CART. So this is captioning, and this is what we have available to us today on the seminar. But captioning is the text of the audio portion, right, of a video or a film or a live presentation that's presented at the bottom of the screen. And so this may include not only the words, but sometimes the sounds that are important to understand the context and the source of the sound. So there are both open captions and closed captions, right? And you guys have probably seen that distinction made, but open captions cannot be turned off. Closed captions are only visible if they are turned on for display. So that's a difference between those. And then there's, in addition to the CART, there's artificial intelligence captions, right? So there's a lot of software programs out there now that overlay with different programs. So like we're using Zoom webinar right now. So I know there is Otter AI, there is Streamer Center, where you have a subscription with one of those plans. You use that software to capture audio, translate it using artificial intelligence into text, and then it can overlay with something like Zoom or even with PowerPoint now, right? PowerPoint, especially if we're I think actually both versions, the software computer-based downloaded version as well as the Microsoft 365 version, has an option to turn on subtitles. And so it uses an AI generator to translate text to speech, and will provide that subtitle within the software program as well. Speech recognition software, and then just the idea of using clear masks so people who read lips can still see lips, because right now we all need to be wearing masks, so that can really inhibit communication, especially particularly in face-to-face scenarios from at least 6 feet away. So the clear masks are a wonderful solution for people who read lips. And then thinking about alerts. So auditory signals that become increasingly louder and amplify noise. So again, for people with hearing impairment. Vibrotactile, those are alarms and signalers that you can feel. So vibrating doorbells, strobe, smoke and fire alarms, vibrating clocks, those kinds of accommodations for hearing for hearing impairment. And then visual indicators, so strobe or flashing lights. There are a lot of alert systems that are much more sophisticated now that use loud tones, higher low registers, flashing lights, and vibrators. And so that, again, is just universal design, right? It's going to be effective and usable for the greatest amount of people. Some of them you can vary the sensitivity. You can have it pick up sounds and send signals to you through different signalers. And so depending on the complexity of the equipment, some systems can be set to notify you using warnings, right, for each of these different alerts. But there's something to pay attention to when you are choosing alert systems for your business or your environment, is to make sure that it is usable and effective and will keep the most amount of people safe to receive that information. Oh man, transportation. Those of us who work with disability, we know this is a huge issue for everyone, but as we are aging and experiencing disability, transportation and driving can become more difficult, less safe, and at times not an option at all, right, for driving. So we know transportation is a huge issue, and even more so in rural areas. Fewer public transit options and less access to public transit. And so for people with disabilities to access services, employment, and participate in the community is a real issue. And so there are increasing solutions. We have more options than we used to address transportation issues at the individual level, many of which we have technology to thank. So we have Uber and Lyft, right? We have apps for those. We can ask our Alexa or our Google Home to schedule rides for us just using voice. Many of our larger cities are also adapting some more accessibility options and having accessible vehicles within those fleets and having that option to select. So that's exciting to see that growing as well. And we also have public transit and paratransit. And then Waze Carpool or Waze Rideshare is another one that Kim mentioned earlier. And so Waze Carpool is a feature that, so it's owned by Google, Waze is, and it will match riders on your route and can offer a ride. You can connect with your friends and indicate when you're going somewhere. It will send, I think, 3 to 4 minutes out of the way to offer rides and share rides. So it's a really neat and growing new way to address transportation barriers, Waze Carpool. And we actually have my colleague Maria Kemplin developed an entire module on this as a transportation solution on the HDI transportation initiative. So I'd encourage you guys to go watch that as well, because she walks through very, very comprehensively how the Waze Carpool works. And then there are networks like the Independent Transportation Network, the ITN, and we have one here in the Bluegrass. And so that provides a rideshare to our seniors and people with disabilities, where you can, while you are still driving, you can give rides to people and earn credits. And so you can use those credits later in your life when you're no longer driving. You can also link your accounts to your family members, where your family can contribute money to that you can use to get rides from people as you need them. But yeah, so that network is available and growing, I'd say, as well, along with our growing aging population and the growing need of the number of people around us, right? ITN. And in Lexington, it's itnbluegrass.org. So I definitely encourage y'all to check out that site as well and learn more about how that works, how we can participate actively in helping to address the huge transportation need of our aging population. And then speaking to the future, this is where things are moving. Autonomous vehicles are going to have such an effect on leveling the field of transportation options for people with disabilities, for again, participating in work, for getting to, appointments and other healthcare meeting their healthcare needs. But there are several Detroit-based companies that collaborated with Michigan's Office of Future Mobility and Electrification Planet to increase accessibility to transportation for underserved populations and the elderly. And so the result of this was a self-driving, accessible paratransit shuttle that they developed. And so they started with just medical appointments for this. So it is currently in its pilot, actually a pilot phase into the last month. But the goal is to increase people's trust for autonomous mobility. I mean, we've all heard for years now about different trials with autonomous vehicles and self-driving vehicles, but really believing that autonomous vehicles are an opportunity to bridge the mobility divide for our marginalized populations. So the pilot phase was August to October. And I need to look back into it and see what the next step is for them. But they had a 1.31 mile route back and forth with an onboard safety operator. But again, the vehicle was moving autonomously, and it was a free service between two pilot communities, a senior center and Brewster Home. So it was going back and forth between the two centers, so to medical appointments and other things, but really starting to build familiarity with it and build data around the use of autonomous vehicles. So I really do think this is where things are moving as well, and will also provide a lot more opportunity to people with that are aging or with issues with transportation. And so why do we focus so much on accommodations? Because good accommodations are effective. Accommodations allow companies to retain valued employees. Kimberly talked a lot about retention at the beginning of the presentation. Accommodations increase productivity, lets people do more in less time and be able to work longer. Accommodations eliminate the cost of training new employees. That's a very real cost to employers. So the more that they can retain people, that more that cost is eliminated or decreased. They can improve interactions with coworkers, and we know that's really beneficial too. To have that relationship building piece helps us all do better. Across the areas of life. Increase overall company morale, right? If you feel like you're being taken well care of by your employer and that they're willing to work with what you need and help figure out how you can continue to accomplish that job, you're going to feel better about it. And then just the increasing again of overall company productivity. So it's really a lot of reasons that we should be providing accommodation, a lot of reasons that they work.
All right, thank you so much. That was a lot of great information, and you deserve a little break now after all of that. So I'll take it for a few minutes and talk about individual perspectives. And we can go ahead and go to the next slide and talk about a couple individuals who I had the opportunity to work with directly in accommodations. And the first individual, their job function required them to read policies and processes to implement programs within their organization. And they had a visual impairment. And what we were able to do, in addition to providing a large monitor and large print, was to, from the organization, was to also look at the Adobe Read Aloud option that they had on their computer as an accommodation as well. So just this individual's perspective and how they were able to have that interactive discussion and interactive process with their employer organization to be able to effectively complete the tasks required of them in their job. Also an individual who was doing primarily data entry as his job and had limited motor skills. And the accommodation for this individual was to utilize drag and dictate, or a dictate function that's available in Word or Google Docs. So again, you know, this individual was involved in the interactive discussion and that interactive process with their organization and made the recommendations. We were able to assist in the coordination of those accommodations pretty quickly and provide that platform so that the data entry function was able to be successfully completed. And so one of the things that we would encourage you to do is look at your local resources in addition to any employer or organizational resources that might be available. The a lot of employers have employee assistance programs or colleague assistance programs that you can tap into that may be able to provide resources related to accommodations. Additionally, there are state and federal resources available as well, and we're going to provide some more specifics on that in the next slide. So one of the resources that you may all be familiar with, and I've had the opportunity to learn a lot about over the last few months, is Retain Kentucky. And we have a group of individuals within HDI that are part of the Retain program that help individuals who have non-occupational disabilities stay at work or return to work. So keep that in mind as an existing resource. The Office of Vocational Rehabilitation in Kentucky can also assist in the Stay at Work and Remain at Work program for individuals with disabilities. The Centers for Independent Living is another great resource that's existing that can be utilized to help find additional support for individuals. The catsnet.org, Kentucky Assistive Technology Project, is another resource. And the Job Accommodation Network, askjan.org, is also a great resource. So there are a lot of great resources available in addition to the University Center on Disability at HDI that you can tap into to assist individuals who are looking for some additional support in the workplace. So it looks like we might have one question here. Let's see. Oh. Well, do we have any questions that you can see on your end?
We do not. I do have a question though. How has we know our bandwidth is more taxed and stretched than ever during COVID right now. How do you think COVID has impacted older workers?
Yeah, that's a great question. I think that, we talked about employer organizations have really had to increase accessibility with work from home. I think our bandwidth in doing things virtually and remotely has increased as well. And so I think that has offered some additional opportunity to older workers to be able to, work from home, especially during this pandemic. So I think there have been increases. I'm hopeful that those increases will continue post pandemic, and that accessibility will continue from a virtual and remote process to allow those older workers to continue to work in a remote capacity if that's what they choose to do.
Have you found in your work that older workers have readily embraced technology?
I would say that I don't know that readily embraced is probably my experience. I think that the technology, a lot of the technology that Christina shared is, especially that uses that universal design concept, does allow them to embrace it more so than it did prior to that universal design being involved. So I know even myself, I lean on my 17 and 20-year-old oftentimes to help me with technology, but I think that with that universal design concept, it is more intuitive, and I think it is easier for older individuals to be able to embrace it.
Yeah, I mean, I'd say it's again like an individual response, but there's definitely been a historical resistance by the aging population to a lot of, you know, technology in general. But agreed, exactly. Like I think that's why universal design being built into some of these devices, most of these devices now, is really important to make it more accessible to that population.
We have a question in the chat from William Kirby. What are the options for the over 55 population to simply learn technology? Most of my clients don't have any computer skills at all, and I cannot find any resources to help them learn.
Yeah, I would say one of the first spots I would suggest is the public libraries. They have a lot of, you know, from basic all the way through specific software offerings. They offer training on and the computers there to use to learn how to navigate computers. You know, in the community colleges, we'll have a lot of introductory offerings as well. And let's see, what was the other one I was thinking of? There's great videos, right? So if they have internet access, even just Googling and watching YouTube videos or videos from the creator developer of those softwares or of computers can walk through, you know, in different ways and at different speeds, how to use computers and the other devices. Oh, you mean, okay, it's actually Pamela Pittman, not William Kirby. No libraries offering classes and haven't since before COVID. Okay, uh, uh, then I'd have to look more in your specific area. You could also potentially utilize your regional assistive technology centers. In Kentucky, we have 5 across the state. I know here in Lexington, we're able to help train people or show people with disabilities on how to access and use a computer and what kinds of accommodations they might need for that.
I would just add to that too, a couple things too, Christina. The libraries might be closed, but if you can get them assistance virtually, they're offering a lot of things online. And I know just recently I learned, you know, I'm pretty basic when it comes to technology. I'm very appreciative of people like you, Christina, but I learned how to create a pivot table. That was like a big deal for me. And I went on YouTube. It was a 6-minute video on YouTube, and it was very basic, and it walked me through step by step. So if you can just, you know, even get them to share screens and help them, you know, walk through something, I think anybody that that has access to a mobile device or computer, YouTube is very helpful in doing that.
Another question that I have is related to technology. How has technology increased work from home opportunities?
Christina, you want to take that one?
Sure, yeah, I would say exponentially, right? So, you know, through COVID-19, we have really identified and made it work, right? So using technologies like Zoom and video conferencing, you know, all of the ones that have been in place for a long time, like email and other such communication tools like Slack, or, you know, our team's ways of staying in contact and having conversation. So, I mean, pretty much demonstrated in these last 8 months that most jobs can be done from home. And so that really increases the pool of work to people who have historically not been permitted to do those jobs from home, right? And so, yeah, very much increased work from home opportunities. And also influenced, you know, some of the fields that have been more in demand because of COVID. Trying to think of an example right now, but there certainly are them.
Any other questions?
We do have a comment in the chat. GCFlearnfree.org is an awesome learning tool for those seeking to improve their skills with many different topics, and it's very user friendly.
Awesome, thank you.
How another question I do have, how does the interactive process work with reasonable accommodations?
Yeah, so as I briefly touched upon, the interactive process allows the individual to have that communication with the employer organization about what they have identified as their needs in doing their job and their job tasks and the essential functions of their job. So again, that term interactive really just captures, you know, the individual and the employer having that process and that discussion to be able to identify what that accommodation can be in the workplace.
Thank you, Kimberly.
Yeah, and going back to maybe the libraries being closed right now, I know that there are, you know, the Khan Academy, Khan, Khan Academy, and a lot of universities that are offering free courses right now. I see that part of the issue is that clients don't have computers or Wi-Fi, and so that, yeah, that is a real concern. So, you know, utilizing a lot of counties in Kentucky, at least, I know with kids in school have been offering free access to the internet during this period of COVID. So really trying to dive into what those regional and local resources are during this time. So also getting devices can be a real barrier, but right now there are a lot of programs that are offering devices for use. You know, certainly the schools are, but there are other programs as well that if you wanted to reach out individually, I'd be glad to help find some of those for your regions.
Another question I have is, I've heard the word ergonomics used quite a lot, and so like if you have a chair at work, is it an ergonomically correct chair? So how would you define ergonomics, or what does ergonomics mean to you?
Yeah, that's a great question, and something that when I initially heard about universal design, my head went right to ergonomics, right? Because that's kind of what my experience has been working with employers and individuals in the workplace. And the definition of ergonomics is the study of people in their working environment. And Christina and I had some discussion about that compared to universal design, and how really, you know, if it truly is a universal design, it probably is an ergonomic environment. Even though by definition, ergonomics is looking at that individual, if we have that universal design, it's probably going to allow that individual to effectively perform their job without risk of injury. So that was something that I kind of had to get my head around a little bit more. And I think Christina had a really good perspective on an example about a workstation, because I gave the example that in ergonomics, you're going to look at things differently from somebody who's, you know, 6 feet tall versus 5 feet tall. And Christina said, I won't take it from you. Go ahead. What was your example?
So, right. So I was thinking in terms of, right, the ergonomic being the features of the individual, like the different height, and the universal design being built into the product, right? So an adjustable desk, a height adjustable desk, or an adjustable chair that can accommodate for someone who is 6'4" or 5'8". That adjustment becomes the ergonomic feature for that individual. The universal design is built into the chair because it can adjust to meet the needs of different people. Kind of. Is that essentially what I think my thought was around wrapping my head around it?
I thought that was a great example, and it helped me get my head around it too.
Do we have any other final comments or questions from our participants today? Okay. Hearing no other questions, I would like to thank both Kimberly and Christina. As advertised, this has been great. It's an honor and a privilege for all of you to join us today. I want to thank Kimberly and Christina for taking time out of their busy schedule this afternoon and join us and to share their expertise and knowledge and experiences with us. I want to wish everyone a wonderful weekend. Be well and stay safe. Take care.
Thank you so much, Walt.
Thank you.